Hi, my name is Michelle Dever. I am a school nurse in Bismarck, North Dakota, and also the president of the North Dakota School Nurse Organization. We wanted to put together a video for parents and school staff to help you make decisions and answer some questions regarding the return to school and the COVID-19 pandemic. This is Molly Howell. She's the Immunization Program Manager and the Assistant Director of the Division of Disease Control at the North Dakota Department of Health. So Molly, what happens when a staff member tests positive for COVID-19?
Well, when anyone in North Dakota tests positive for COVID-19, that should be reported to the North Dakota Department of Health by the healthcare provider or by the laboratory where the test was positive. And so once we get that report, either the Department of Health or one of our partners, which could be a local public health unit or school of public health, will contact that individual. We'll notify them that they need to isolate at home, and we'll interview them to better understand what their symptoms are. Did they have a history of travel? Did they have a history of being around someone else with COVID? We'll determine who their close contacts are and where they have been since they've been contagious. And then once we're done interviewing that person, then we would go on to notify their close contacts, which is someone within 6 feet for 15 minutes or more. We would notify their close contacts that they need to quarantine, which means stay home, stay away from others. Obviously, you may be able to be around some people in your household, but no one should be entering the home that's not normally in the home. And then that quarantine period is for 14 days from when they were last exposed to the individual who tested positive.
So likely in a school setting, that would mean the classroom that staff member spends time with, if they're a classroom teacher, or if there are any other staff, possibly support staff who are with many children throughout the day, those kids and other staff members could be close contacts too.
They could be. So if through our case investigation we find out that the individual, because we do get where are you employed at or where have you been while you're contagious, and so if they report working at a school, then we would follow up with that school. We would notify them that they had an individual who tested positive. Every school is supposed to be providing us with somebody that we can get a hold of, even on evenings and weekends. So we'll do that as soon as we're aware of the case. And then that's when we would determine who that individual was in contact with in this school setting. And it would be the same. It would be within 6 feet for 15 minutes or more. And so yeah, that would generally be people that they work with in an enclosed setting or closely with. Hopefully teachers are distancing themselves from children, but obviously that's not realistic in all situations. And so children may be close contacts of teachers. It's just really going to depend on how well the school and the staff and the students are maintaining that 6-foot distance. If you have a staff member who floats throughout your building or works in multiple classrooms or has contact with children in different classrooms throughout the day, and that staff member tests positive for COVID-19, then that may impact multiple classrooms or multiple areas of the school. So as much as possible, schools should be encouraged to not have staff float throughout the building. If you can, have maybe children come to you. I know, for instance, my mom was a speech pathologist. Maybe send kids to go see the speech pathologist instead of having the speech pathologist come to every classroom in the school, just to minimize the amount of students that could be potentially exposed to that floating staff member.
So that if the speech pathologist tests positive, the child that's spent time with them, they'll be quarantined, but not necessarily the entire classroom that child is in.
Yes.
So while we're talking about that, can you kind of discuss the pod philosophy that the state is recommending?
Yeah, so with COVID, because a close contact is defined as anyone within 6 feet for 15 cumulative minutes or more, The reason why we're recommending cohorting or podding to schools is because that's really going to reduce the number of close contacts that everybody has. And so if you had a positive case and students were cohorted or in pods, the idea would be that only that cohort of children or that pod would be close contacts and then need to quarantine. Whereas if you're not cohorting and everybody is a close contact of each other in the classroom or even in the grade or the school for that matter, then everybody would be a close contact and have to be sent home and quarantined for 14 days.
So in other words, it's trying to eliminate an entire school being quarantined, just a classroom possibly.
Yes, just a classroom, or even if at all possible, even smaller. If for some reason there's a way to keep kids in even smaller pods of like 5 or 10, whatever you can do to minimize the number of contacts that everybody has is going to be best for the children, staff, and the school to ensure that schools can keep kids going to school this year.
What about kids? You kind of talked about staff. What if a child in the classroom tests positive?
So the process would be the same. That would be reported to the North Dakota Department of Health. If for some reason a school ever finds out about a positive case before we do, they can also always call us and report it, especially along the borders. Sometimes if people have an out-of-state address, we don't know that they're a North Dakota resident or that they attend school or work in North Dakota. And so definitely if a school finds out about a case, they can also report it to us. But we would investigate, we would determine who was close contacts, we would still follow up with the school, and it really would be the same process that whoever that student was around for 15 minutes or more within 6 feet would be a close contact, and we would recommend quarantine for 14 days. And then anyone who tests positive, they need to isolate for 10 days. And so that isolation period is 10 days from either their onset of symptoms for when their first symptom was, or if they're asymptomatic, it's 10 days from the date that they had their test done. And so either way, both the case will be kept out of school and then the contacts will also be kept out of school for the quarantine.
So potentially with that 14-day and 10-day, if a child is quarantined for that 14-day time period and on day 14 they test positive, they would be home for another 10 days. So potentially they could be home for 24 days.
Correct, yes. Yes. Cases all need to isolate for 10 days and contacts all need to quarantine for 14 days. One thing that often comes up that people don't really understand is why does a case get to stay home for less time than a contact? And the reason is because people who have COVID or are what we call cases, they are contagious for 10 days. And so that's why we recommend that they isolate for 10 days. For contacts, a quarantine, that's what we call the incubation period. And so that's the time period for how long it can take for them to actually have COVID or test positive for COVID. And that can be as long as 14 days. And so that's why contacts have to stay home longer than cases. It doesn't really seem fair, but that's kind of how it's working.
It's how the virus works.
Yes.
What about if a parent or a sibling of a child tests positive in a school setting?
That's another good question that we get quite often. If a parent or a sibling or someone in a household tests positive and the child attends school or is a worker, that child or staff member would have to quarantine for 14 days. The tricky thing about household contacts is that because they're continuously exposed to the case in the household, they have to stay home for the case's 10-day isolation period plus their 14-day quarantine period, because there's a potential that they could still be exposed on day 10 of the case's isolation period, and then have 14 days for their quarantine where they could eventually develop COVID. So household contacts kind of become a little tricky there, where they may end up staying home for prolonged periods of time.
So let me just reiterate. So if a teacher's child tests positive, that teacher is home for 10 days while their child is recovering, while they're contagious, and another 14 days because they could have been exposed on day 10 and they want that incubation period to be over, so they would be safe to come back after that full 24 days.
Yes, as a worst case scenario, yes.
Okay.
I mean, generally, we don't find out about cases on day 0, so usually that 10-day isolation period has already started. Also, if the teacher were to say, in your example, test positive, because we do recommend that all close contacts are tested for COVID. We recommend they go in about 7 to 10 days after they were exposed. If that teacher tests positive, then instead of a 14-day quarantine, they then would start a 10-day isolation where they had to stay home and recover for 10 days.
But that classroom, the teacher, if the teacher's child tested positive, the teacher tested negative, the classroom does not need to quarantine, and the classroom does not need to quarantine while they're waiting for the results of that test.
Correct, that's a good question. And so if you have a contact in your school, a close contact, so somebody that was identified by public health that they were a close contact to somebody who tested positive for COVID, if it's just a contact, then contacts of that contact don't have to stay home, don't have to quarantine. Just that person would have to stay home. So in your example, just the teacher would have to stay home and the school could get a substitute teacher to run the classroom while that teacher was staying home.
Some schools are adopting a mask requirement. Will that change anything if a student or staff member tests positive?
Well, masks have been shown to reduce transmission of COVID-19 by 33%. And so they will have an impact potentially on the number of cases that you would have in a school setting. But in terms of quarantine or who's a close contact, even if a case was wearing a mask and if contacts are wearing a mask, if they're still within 6 feet of each other for 15 minutes or more, we would recommend that those contacts be quarantined and stay home for 14 days.
So if a child or staff member tests positive and that classroom is quarantined at home, you had mentioned that the state is recommending that all close contacts go contact their primary care physician and be tested for COVID. If they are tested and they test negative, can they come back right away?
So yes, we do recommend that all close contacts go in and be tested about 7 to 10 days after they were exposed. Don't go right away because you might be what we call a false negative, or you might not have a positive test result yet, because in general it takes, 2 would be the earliest that you would maybe test positive 2 days after exposure, but the average is about 4 to 5 days. And so we recommend at 7 to 10 days, they go in and be tested. You don't have to go to a healthcare provider. You definitely can, but you can also go to one of the static sites that are being set up around North Dakota. Those are listed on our website. But really, even if you test negative, that does not mean that you can get out of quarantine somehow or come back to school earlier. Even people who test negative have to complete their 14-day quarantine, and that's because it can take up to 14 days to be positive. And so you may test negative on day 7, but there's still that possibility you could be positive on day 10 or day 14. And so that's why we recommend completing that quarantine period regardless of the test results.
Sometimes communities will set up testing sites for anybody to go get tested. And you may not be symptomatic, you may just be curious. If you go to one of those sites and you are tested, do you need to quarantine until you receive the results of that test?
So if you don't have symptoms and you're not a close contact, and you go in to be tested for COVID-19 to one of these static testing sites, you don't have to stay home pending your test results. But if you do have symptoms of COVID-19, or you were identified as a close contact to somebody with COVID-19, then you do need to stay home and wait for your test results.
Now, what if a child is quarantined because of a case in daycare or before or after school care or maybe sports? Does that mean they have to quarantine from school also?
So if you were identified as a close contact, regardless of the venue or situation, and you were advised to quarantine for 14 days, that means staying home and no school, no activities where you're around other people, no large gatherings, no going to the mall, grocery store. It really means that you're quarantined at home and can only be around people that are immediate household members. And so we also don't want other people coming into the home. So grandma and grandpa shouldn't be coming into the home, other babysitters, anything like that. So yes, you would have to stay home from school, even if the exposure occurred outside of school.
Are there any activities that schools should not participate in this school year, or anything that schools should consider, like common manipulatives that kids may use, or common play areas, anything that schools need to consider when they're making decisions regarding that?
Any activities where that 6-foot social distancing can't be maintained are just in general riskier for COVID. And so anything where people are gathering together, for instance, it's probably better not to send children to go to the cafeteria for lunch. It would be much better to bring lunches back into the classroom so only the same kids were contacts of each other. You don't want to have large pep rallies where high numbers of kids are together in a gym or something like that. So anything where that social distancing can't be maintained is probably not a good idea during the COVID-19 pandemic. Also anything with probably high touch where you have a lot of kids touching the same thing and it can't be cleaned between uses or something like that. So I would guess manipulatives,
School supplies,
School
maybe.
supplies, everybody should ideally have their own school supplies, not sharing of school supplies, especially if it's something that can't be cleaned. It's really about minimizing a high number of people having contact with each other or having contact with the same surfaces.
What considerations need to be made for band and choir?
There haven't been a lot of studies done around band. There was an article published on choir and a high number of individuals becoming infected singing together. And that's just because when you're singing, you're expelling a lot of air. And so if schools are going to continue with choir, ideally you want to mask when people are not singing, try and keep people at a 6-foot distance away from each other. I know it's hard in North Dakota. A lot of the recommendations say try and do as much outside as you can. But in the fall and maybe in the spring, if you can go outside as much as possible, be going outside. If you can open windows. And then while you are singing, that 6-foot distance is going to be critical. And then also not mixing of students. So if you think through the day, you want to keep the same cohort of students together. So as much as possible, don't bring different cohorts together or mix students. So even if you can do choir in the classroom or something like that would be better than mixing students or not maintaining that 6-foot distance.
So since we're on the subject of that, let's talk about the secondary school format. So they aren't with one teacher, they're going from classroom to classroom to classroom. If a student in high school, for example, would test positive, that means that every class that they attend, all of those classrooms would be potential close contacts, and all of those children and teachers could potentially be isolated, quarantined at home.
Secondary and high school are going to be challenging, especially if students are going from class to class. I do know some schools are looking at rotating the teachers instead of the student, which is probably a smart idea to reduce the number of close contacts. If schools can have assigned seating, that's helpful. So when we interview the student, they know who was sitting in front of them, right next to them, or behind them. Ideally, in a high school situation, we will be able to interview the student and better understand who were their close friends, who were their close contacts in the school setting. And ideally, teachers in the secondary schools should really maintain 6-foot distance from students as much as possible. There really isn't a need for them to have that close of contact with students. But as much as possible, again, if students can't mix and intermingle, if there is a way to cohort them as much as possible. Also thinking about hallways and lockers. A lot of times students congregate around lockers in the hallway. In Europe, a lot of times they had students going one direction down different hallways. And so even thinking about that, if students are all going in one direction, that's going to reduce everybody congregating or being in close proximity to each other in a hallway.
So this is the question of the hour. With all of the childhood illnesses, not even childhood, all of the illnesses that go through schools during cold and flu season during the school year, how do we distinguish as school staff or parents, how do we distinguish between this is COVID, this is just allergies? How do we make those decisions on who needs to be sent home, who needs to be checked out by their doctor? How do we navigate this?
Yeah, the tricky thing about COVID-19 is it looks like every other respiratory illness out there. The symptoms are fever, generally 100.4 or higher, sore throat, runny nose, congestion, headache. One of the distinct symptoms is loss of taste or smell. That's a pretty distinct symptom that cases are seeing. But even gastrointestinal symptoms like vomiting and diarrhea have been associated with COVID. So it will be really different or difficult to determine if it's COVID or something else. And so the Centers for Disease Control and Prevention recommend that schools follow their general infectious disease illness exclusion guidance. They're not recommending that schools formally screen students as they're walking into the school. You don't need to do fever checks and exclude people. What they do recommend is that parents screen their children at home to determine if they're sick or not. If your child has a fever of 100.4 or greater, if they're showing signs of illness, if they're obviously vomiting or have diarrhea, they shouldn't go to school and be excluded, but they can return to school without a COVID-19 test.
When can students return to school after symptoms are present?
As long as it's been 24 hours since they've recovered or are feeling better, or 24 hours that they've been fever-free for 24 hours or more. Now, if they're not getting better, or if your child is really sick and you have concerns, definitely contact your child's healthcare provider and they'll determine whether or not to test your child. Also, if your child is a close contact or has gone to large gatherings or traveled recently, then you'll want to definitely consider getting them tested for COVID. But otherwise, the school won't necessarily be saying you need to go get a COVID test or you need to stay home, we think this is COVID. It would just be follow the general illness exclusion guidance that you do every single other year. Maybe do a little better this year, but yes.
A little bit stricter maybe.
Yes, yeah.
So just as we have in past years, if a child is not feeling well, we would call parents, send them home. If a child has a fever, if a child has, the thing that will look different this year is that a runny nose, a cough will probably go home, where in past years, if the child was still able to participate in class, we would let them stay. So we'll just be a little bit stricter on that. But they do not have to see their doctor. They do not have to get a COVID-19 test once their symptoms are over. or that it's been 24 hours since they've had a fever, or vomited, or have had diarrhea, they can return to school just as they have in past years.
That is correct.
Should children be vaccinated against influenza this year?
This is my plug for flu vaccine for this school year. Generally, only half of North Dakotans get vaccinated every year against influenza. But if schools are going to be more strict about keeping kids at home, it's going to be more important than ever that kids get vaccinated against influenza, because if they have a cough or fever, it could be influenza, but your child is going to be kept out of school, where in past years your child maybe was still coming to school with flu. And so if you want to keep your child healthy this fall and in school, one of the greatest things you can do is get your child vaccinated for influenza this school year, in addition, of course, to other school required vaccines.
So the governor has asked, and the state of North Dakota has asked, that every school district come up with a plan that best fits their district. Instead of the state saying, this is what you're going to do, they're going to give local control and ask the school districts to find out what works best for their school and their community. How can I find out what my school district's policy is?
Yeah, so school districts are supposed to be posting their policies on their websites, and so I think your best course of action if you want to know what the plan is to go to the school district website and take a look, and they have been outlined pretty clearly. A lot of school districts are even doing news releases or holding public hearings about what their plan is going to be, and even including parents in some of that decision making around what's going to happen this school year. So yeah, I encourage everyone to go to their school's website or their district website.
If my child misses multiple days this school year due to symptoms or quarantine, will he or she need to repeat a grade or extend their school year?
If students are quarantined, they're not sick because you're quarantined. You're still healthy and staying home and watching for symptoms, and so you can still attend class virtually, and every school is supposed to have that option for students to attend class virtually.
So even if a child or a classroom is quarantined because of contact with somebody with COVID, the school district is supposed to have an alternative for that child, so they're not without learning in those 2 weeks. They still have the option to do some type of distance learning while they're in quarantine.
Exactly, and so everyone will have an opportunity to learn even if they're excluded from school.
So parents don't need to be concerned about their child missing lots of education, lots of days because of mild symptoms or quarantine this school year. They don't need to be concerned about their child needing to repeat a grade or be in a longer school year because the school districts are addressing that.
Exactly, yep. I think the other thing I would want to mention is, even if a school is perfect about social distancing and keeping everyone 6 feet apart, and even if they use masks, there still are probably going to be COVID-19 cases in the school, and parents need to be prepared, and employers need to be prepared that there is going to be interruptions, where there are going to be periods of time where kids are going to have to stay home as our parents from work. And I also think we can prevent cases of COVID being introduced into the school, but a lot of it is going to also depend on what kids are doing after school and on the weekends. And so if your child is being socially distanced at school and the school is doing a really good job, but as a parent at home, you're letting them go to large gatherings or have close contact with others, there's still a risk of COVID, and that's going to be eventually an interruption to the school if your child is a close contact outside of the school setting or becomes a case. And so parents also play a role here in making sure their children are protected outside of school, and that'll be really important this fall as well.
So families need to have kind of a backup plan because there's a really good chance that sometime throughout the school year, you or your child will be a close contact and you will be home for a time period. So you need to have a backup plan. What's that going to look like in your house? And I think having a plan maybe will reduce some of the anxiety that comes along with what are we going to do now that we're home?
Yeah, everyone should have a backup plan, and the backup plan should not include grandma and grandpa or anyone who has underlying health conditions. And ideally, if someone in the household is quarantined, that means no one should be coming into that household to watch your child that doesn't already live in your household. And so parents should have a plan and be prepared that they'll have to stay home with their child, and don't plan on having grandma and grandpa come in and watch your child. That probably wouldn't be a good idea, as they're at higher risk for serious complications due to COVID-19.
What will sports and extracurricular activities look like this school year?
It's sounding like high school activities are planned to start this school year. And so I think for some sports, obviously it's going to be very difficult to socially distance. Some sports may be able to do that. So as much as possible, it's going to be the same thing. The whole goal will be reducing the number of close contacts. And so if at all possible, like at practices, if you can have cohorting or pods of kids, so if one of them tests positive, that there's less kids that will have to be quarantined. As much as possible, if you can mask while not playing, or even if masks are tolerable while you are playing, that'll prevent a number of cases in extracurricular activities. For events, we don't want to have large gatherings. Schools, if they're going to have events at their school, they have to follow the North Dakota Smart Restart guidelines for large gatherings. And so we're not going to see as many people being able to attend sporting events. And so as much as possible, if people can televise them or stream them on the internet or something like that, so people can watch from a distance, that'll reduce the number of cases. But with sports, people should anticipate if there is a case on a sports team, then it's highly likely that the rest of the team are going to be close contacts, especially if they're, riding on a bus together to travel, to play another team, if they're in the locker room together, or if it's a close contact sport like football or hockey. A lot of those people are going to be contacts and have to quarantine. So that means the entire team will be out for 14 days. And so that's going to impact your own team and then any teams that you were scheduled to play in that 2-week time period. And so people are going to have to be prepared for that this fall. It's going to be difficult with athletics. So as much social distancing as possible, the better.
What are the recommendations for busing this school year?
We do get some questions about if kids are on a bus together, are they close contacts? I would, if possible, recommend that children mask if they're taking the bus to school. That'll prevent cases. Also, the bus driver should be masked. If possible, assigned seating on a bus would be helpful. So if there was someone who tests positive that rode the bus to school, we would know who is sitting next to them or in front of them or behind them, because generally that would be who the close contacts are, would be in front, right next to, and behind. Because really, if we don't know, we might have to quarantine the entire bus if we can't determine who was a close contact. And so for kids riding the bus, mask and assigned seating, and if you can space them out, I know that might be difficult, 6 feet apart, that would be the ideal situation, but if not possible, then assigned seating this school year.
Should I continue with well child visits and immunizations during this pandemic?
This fall, more than ever, maintaining the health of your child will be important. 1, so your child doesn't get excluded from school for being ill. 2, because we don't want to place an undue burden on healthcare providers that are already taxed with, seeing people for COVID-19 and testing people for COVID-19. And so this school year, all immunizations will still be required for school. Children should be vaccinated according to the school requirements, which can be found on the Department of Health website. And they should be vaccinated prior to the start of school. And if for some reason they're delayed in vaccination, they have until October 1st. And then after October 1st, children will be excluded from school if they haven't submitted either an immunization record or an exemption documentation to the school. And so immunizations will be important this fall, but in general, parents are recommended to see their healthcare provider with their child so their child can have a well visit just to check how their child is developmentally doing, making sure their child is healthy and happy for this school year. I do know high school activity physicals, it's my understanding, are not required this school year, but immunizations are still required for school this year.
And I think it's important for parents to know that pediatricians are still seeing children for well child visits, so definitely make those well child visits, get your child immunized. If you have the ability to have a sports physical, absolutely do that, even though the Activities Association is saying that you can use your documentation from last year. But if you are able, you should definitely do that. If your child is on any medication, controller medication for asthma or diabetes or mental health, definitely now would not be the time to forget to refill that prescription. Stay on your controller medications.
Exactly, and I know some parents maybe were a little concerned about bringing their child to the doctor with COVID going around. Healthcare providers have gotten very creative with how they're able to see patients. A lot of providers are doing well visits in the morning and then seeing sick patients in the afternoon, or a lot of healthcare providers are testing for COVID at drive-through clinics or special clinics that they've set up, and so COVID patients aren't necessarily going to your healthcare provider. They may be directed to a different location, and so providers have been able to figure out how to see patients safely during COVID, and so it is still recommended if you should be seeing your doctor for some sort of maintenance or for immunizations that you do still go in.
Is there a vaccine for COVID-19?
We know that they are working on a vaccine for COVID. I think there's even 2 that are being tested at this point. What are your thoughts on vaccination for COVID?
Yeah, there are a number of vaccines in the pipeline, and a few of them look promising and are moving into phase 3 clinical trials. I know a lot of people have heard about Operation Warp Speed, and some people are feeling like that means they're rushing a COVID-19 vaccine when they are still going through clinical trials and the proper channels, and will still have to, go to the Food and Drug Administration for approval. But it is looking like there will be a COVID-19 vaccine either by the end of this year or sometime next year. It's still unclear who will be recommended to receive that vaccine when it first comes out, as there probably won't be enough doses to go around for everyone. And so people at higher risk for COVID-19 or healthcare providers will probably be prioritized for vaccination. But we should know more in the future, and we are hopeful it's on its way. In terms of if COVID-19 will be required, the North Dakota legislature sets who is required to be vaccinated for school and childcare in North Dakota. It is possible certain employers like health systems or long-term cares may require COVID-19 vaccine for their employees. But in terms of school or childcare, that is really set by the North Dakota legislature.
Do you think the COVID vaccine will be a one-time vaccine, or do you think this will be a yearly vaccine just as the flu vaccine is?
Well, right now it's looking like the COVID-19 vaccines that may be available will need to be 2 doses about a month apart. But there is potential that COVID-19 kind of becomes like seasonal influenza. We really don't know yet if people can get it again, but I think we're thinking that is possible. And if that's the case, then it may more look like flu vaccine, where it's just another vaccine that we have to get every year. I think that's still kind of up in the air.
This COVID-19 pandemic has been a stressful event in everybody's lives. We know that it can produce fear and anxiety, and we know that being quarantined can feel isolating and lonely and increase that fear and anxiety. Please don't forget to take care of yourself. Look for those symptoms in yourself and your family members, and don't be afraid to reach out for help. Together, we can get through this pandemic. For more information about mental health services or just the pandemic in general, you can reach out to the CDC's website, North Dakota Department of Health, or the North Dakota School Nurse Organization.